the Association of Black Cardiologists and the American Heart Association have very common interests in prevention of cardiovascular disease. The AHA has a 2020 impact goal to improve cardiovascular health of all Americans by 20% by 2020. And the only way we're going to get there is to make sure that health inequities are narrowed. Okay. The populations that have the largest burden of cardiovascular disease are minority populations. And if we ignore minority populations, in our own self-interest in getting to our goal, we'll never get there. But more importantly, it's important that we focus on the broad spectrum of people in the United States.
Now, so, why do you think there's this disparity?
There may be a number of reasons. One may be access.
Okay.
Other may be that there isn't culturally sensitive health information that's out there that people can understand, can act to, can know what's actionable, and things that they have no control over. But so I think there are a number of reasons that involve communication, that involve access, and it's not just African Americans, but it's Hispanic Americans and in some cases Asian Americans.
Right.
The risk factors that people suffer are pretty common. They may be weighted a little bit differently in different populations. So, you know, we have people who are not active enough and they're overweight. We have people who have poor diets. We have people who have high cholesterol, have high blood pressure, have high blood sugar. All these things contribute to your risk of cardiovascular disease and stroke. In some populations, high cholesterol may be more important than, for example, high blood pressure, and diabetes disproportionately affects the African American population.
Right.
We, in collaboration with ABC, want to target particularly those risk factors and make sure we drive those down so we can drive down rates of heart attack and stroke.
So what interventions are being used to address the problem now?
That's a great question. So this is, in people who don't have disease already, it's a pre-medical problem. It's not something that doctors deal with. It's in fact involves urban policy. It involves working with the food industry to make sure that people have access to good food. And those who have disease, to make sure that the secondary prevention measures that we know work, aspirin, medicines to lower blood pressure, medicines to lower fats, are gotten to people who actually need them. But so, for example, in Baltimore, one of the pre-medical things we're doing is a community kitchen. Community kitchen is a program that actually trains chefs to make heart-healthy food, and it's in a part of Baltimore that's a food desert.
Okay.
So, in addition to the kitchen program where chefs are trained, there are nutritionists that are part of the university that are there, and people can come in and actually order food. Pick up their food there at the library.
Now,
but you're actually teaching people how to
exactly.
Exactly right.
And food tastes good too.
But you know, the thing is, you have to do it in a way that people will eat the food. I mean,
sure.
You know, there are different diets, for
absolutely
different cultures, and
you have different tastes. You have different with expectations in terms of spices.
Sure.
Exactly.
You know, so it has, as you said before, if they're not going to eat it, doesn't matter how healthy.
The palate has to fit the culture.
And most spices aren't bad. It's not a matter of eliminating most spices. It's a matter of eliminating certain things, like lots of salt.
Right.
I mean, salt's a big problem. Salt's a big problem in all communities. But if we can drive down the amount of salt that people consume, we can lower the blood pressure of the population. And lowering the blood pressure of the population will reduce risk of heart attack, but more importantly, reduce the risk of stroke.
Right. So what success have you had as far as this is concerned?
I was wondering about
I mean,
about
are people starting to catch on?
So we're having some successes with community gardens, community kitchens, getting people to exercise more. So there are programs that the Heart Association has, for example, Power to End Stroke, or the Get Start movement, where people are exercising more. But we need to make sure that the environments are amenable to people starting to walk. If people don't feel safe in their environment, they won't.
Exactly.
They won't walk because, you know, they'll be worried about what's going to happen to them if they get out and about.
And if parks are available for kids to play ball safely in.
And to make sure that our schools are taking care of our kids' needs, making sure they're getting enough activity during the day. We've worked with the Clinton Alliance to try and Michelle Obama to try and remove sugar-sweetened beverages from vending machines in schools, which are a source of enormous numbers of calories. And one of the things that's kind of looming on the horizon, we've done well in terms of reducing the incidence of cardiovascular disease and stroke, but we now have an epidemic of obesity that's occurring disproportionately in young people.
Exactly.
And
what do
we
you
are going to see an increase in type 2 diabetes, an increase in cardiovascular disease, if we don't bend this curve and get these kids to be more active and to consume the right kinds of foods.
and their morbidity rate. I mean, they're going to. Well, I mean, what is it now? It's like if they continue on this trend, they've lost like 10 years on their life.
Yeah. So the interesting thing is, and it's sad and sobering, is that this is the first generation in the history of this country that may not live longer than their parents.
That's horrifying.
Yes, it is.
And
it
do
is.
the diet, exercise.
But you said it's a sociological problem as much as anything else, which I find really interesting.
Yes.
You know, because if you can't be safe in the communities you live in, there's a real problem in terms of getting out, getting the kind of exercise you need.
Absolutely. Or if the environment, if it's a super highway that you live next to, and
Exactly.
there's no green space and no park to walk in.
Or there are restaurants are all serve high-fat foods.
Yes.
Right.
So I think the American Heart Association and the ABC are working with a totally different set of partners. I mean, it's not just pharmaceutical companies and device companies. It's the restaurant industry. It's government policymakers. It's urban planners. These are the new partners that we hope are going to get us to a place where we can really say we've had a tangible effect on the cardiovascular health of particularly our youth. The tobacco cessation program, which, we haven't won the tobacco war yet, but the reason we've been so successful is we targeted our kids, and our kids put pressure on their parents.
Exactly.
Right.
So I think that's just an untapped resource that we really need to tap into.
Right.
The kids are the internet of the future.
Exactly. That's my generation, though. I remember.
Exactly. No, come on, it's not your generation.
The idea.
Why I
the
understand what
idea
you mean,
of targeting kids to then,
exactly, to get
put
their
pressure on
kids.
the
No, you're right.
That's what we did.
So our generation, that strategy was deployed in our generation.
Yes.
Because our parents smoked, and we're the ones who got our parents to stop smoking, if they did stop smoking.
Right.
So.
I mean, you see them on TV, remember? Right?
Oh, yeah.
Smoking, just
Sure.
like everybody was smoking on TV. Now that's like horrifying.
Right.
You know, you don't
It
even
was
see
a
anything
social
like that.
norm, really.
Yes.
We're so grateful for you coming on. Thank you for taking the time
It's absolutely my pleasure.
to talk about this wonderful organization, the American Heart Association.
Doing
We're
great
partnering
things
with
in the community,
ABC.
right.
Absolutely. Thank you so much.
Pleasure.